to talk about this really important issue. So we can start off. Julia, would you like to start off and just share a little bit more about yourself? We'll go around. Great.
Yeah, sure. So first of all, Arti, and to your entire team, thank you so much for inviting me to be part of this town hall discussion this evening, and welcome to everybody out there watching. So as Arti said, I am a clinical social worker, psychotherapist. I have practice offices in Midland Park, New Jersey, which is Bergen County, and in Midtown Manhattan. But these days, my sessions are happening similarly to this. I'm doing telehealth with all of my clients, which is, knock on wood, going well so far. My background as a clinician is in crisis intervention and trauma treatment, and I have specialized largely in working in healthcare centers, major medical institutions for the bulk of my career, so providing services in emergency room settings and throughout hospital settings. And specifically, my work focuses on survivors of childhood sexual abuse, rape, sexual assault, and domestic violence or intimate partner violence. And I am especially grateful to be here with you tonight, April 29th. April is nationally recognized as Sexual Assault Awareness Month, and the 29th is internationally recognized as Denim Day. So I'm wearing my denim shirt in support and recognition of survivors of sexual violence.
Thank you for that. Appreciate it. Kevin, do you want to go next?
Sure. Hello, everyone, and thank you to the RT team for putting this together. I think this is an extremely important topic and it can't be talked about more. My name is Dr. Kevin Brennan. I'm a psychologist. I've been a clinical psychologist doing therapy with families and children and couples and everyone for about 16 years. I am currently, my office is in my house, which is in Glen Rock, and I've been a Glen Rock therapist for almost 9 years now. You're actually seeing, this is my therapy office right behind me. That's my chair, that's your chair. My particular concentration tends to be with children and also parents. I am considered a parent consultant who helps to, basically I try to teach what I know about kids to parents so that the parents can treat their kids, because coming to me for 45 minutes out of every week isn't really as impactful as giving them the knowledge that they can use with their own children. But I also work with adults and couples and families at large as well. I'm also the Glen Rock Board of Ed. I'm a Board of Ed trustee here in Glen Rock. Lots of things going on there as well that I'm trying to poke my head into for the sake of wellness and health and safety as well. So glad to be here.
Great, thank you, Kevin. Jose.
Great, thanks for the invitation, Arti and the team, and we're excited to endorse your campaign. So I'm Jose Vasquez, Executive Director of Common Defense. Served in the U.S. Army from 1992 to 2007 as a combat medic and a nurse. I have, for the last 15 years or so, been working in the veterans community in various capacities. And I think probably most people have a sense that mental health is certainly something that the veterans community struggles with, maybe more so than the average person in the population, because of just the whole range of issues that people experience while they're in the military, particularly those folks that have served in combat. But I would also say women, in addition to facing all the same things that their fellow service members face, they also have to disproportionately deal with the issue of sexual assault and harassment and violence. So sort of a double-edged sword there if you're a woman or a femme presenting person who's in the military. So Common Defense, we are a national organization, and right now, because of the COVID pandemic, we've certainly had to sort of shift gears from the very political work that we do on a regular basis and kind of base building and organizing kind of campaign work So we've been, checking in with our membership, as well as actually helping some elected officials do phone banking with their districts or their constituents. So we are actually scheduled to do a veterans phone bank of Rashida Tlaib's district. We're going to call through all of the veterans that they have on their list and just do wellness checks with folks. The last thing I'll say is, in the midst of this COVID crisis, of the 9 million vets that the VA system, treats, and that's out of a total of 19 million vets overall in the country that are, currently alive. The overwhelming majority of those vets are over 65, and so the veterans community is particularly hard hit by this pandemic. Just because a lot of vets leave the service with pre-existing conditions, so physical but also mental health issues. And so the Bob Woodruff Foundation just recently put out a study that basically said this pandemic is sort of the perfect storm for veterans because it creates isolation with folks who are already struggling with mental health issues, and folks aren't even able to sort of get the access to care that they so desperately need. So I'll leave it there for now, but excited to continue this discussion.
Yeah, no, thank you, Jose. And actually, that's a perfect jumping off point. So, in our district in Paramus, recently over this past month, we've heard, we've uncovered or discovered the long-term health facility for veterans in Paramus, New Jersey, and frankly, the COVID-19 infection there. So many people, unfortunately, have died. Staff members were infected, died, and just it uncovered a whole bunch of lack of healthcare, lack of knowledge, lack of really follow through and supervision, all of it, in there. And I think that kind of reflect this perfect storm that you're talking about. I'd love to hear more from your perspective about, what are you seeing? Is the long-term care facility in Paramus an anomaly? And really, what can we do? What can we do as part of the community, and what can we think about for the future? Because it's one of the most devastating things is having to deal with it from the outside as a community, but also when you're in the middle of it and understanding that the isolation is even worse, and it's difficult to figure out how to help. And I'd love your input on that.
Yeah, for sure. So, we're definitely tracking the situation with, Veterans Health Administration, as well as, the nursing facilities. Probably most people don't even realize that the VA sort of has a network of these retirement communities, many of which are state run, but affiliated with the VA system. And so, Paramus, I think, is unfortunately, just a sign of things to come. We have members that actually work at the Bronx VA, where they also have a nursing facility. And, he was one of the first people to sort of let us know that, like, what the VA is reporting is sounds low to me, just based on what we're seeing here in the hospital itself, in the facility. And I should add, my father's a Vietnam vet, and I was actually trying to get him into that nursing facility, and wasn't able to because what I later learned was the COVID outbreak. But at first they were just telling us it was a flu outbreak amongst the residents there. So, the other thing that probably people don't know about the VA system is that it's got an additional mission, which is to augment the local infrastructure, healthcare infrastructure. The VA is kind of a nationwide network, and so part of their mission is to sort of back up any healthcare facilities that get overwhelmed. But I think what we're seeing is that the VA is just not doing so good right now on its own. Much less being able to back up other healthcare facilities. And so, what we're seeing, I live in New York City, and so what we're seeing here is, we're calling out, we're mobilizing reservists and National Guard to build field hospitals at the Javits Center to sort of help out and boost our capacity here in the city. The latest numbers is that the VA is reporting 7,900 cases of tested positive for COVID. they've administered just under 100,000 tests nationwide. And then let's see, on the VA employee side, there's about 2,153 of them that have contracted COVID. 20 have died, and it's just like everywhere else. But I think indicative of the situation that we're in. We're not. They're just not prepared. They're not ready for this. The National Nurses United represents many of the nurses that work at the VA facilities, and they actually had protests outside saying, they're being asked to wear masks for, they're issued one mask for the whole week, and things like that. So, how this kind of relates back to the mental health crisis is, I think that already the VA was facing some challenges, particularly after the Mission Act was passed. So there was funding that was being pulled from the VA system. There's an effort, which the Trump administration is supportive of, to basically privatize the VA system. For folks that are on the right that view the VA as sort of like the last bastion of socialized medicine in this country, right? Or at least one of the largest. It's the largest healthcare system in the nation. Having a system that is fully funded by the VA, I mean, it's basically, it's what a single payer system could look like, or certainly a way to sort of test something like that out. Healthcare is definitely on the chopping block. So I know many veterans that were able to access, individual therapy, group therapy, couples counseling through the VA system, and a lot of that is being, underfunded or defunded entirely. And so folks that were able to get, multiple therapy sessions per week, are being pared down to like one meeting a month, which, those of you that are therapists know that you can only get so far with somebody who's dealing with, suicidal ideation and that sort of thing, with one meeting a month, and now they're having to do it virtually. So that's definitely concerning. Suicide among veterans is, through the roof, and it has been for many years. And so I think that, it's, I guess to get to your question about like, what do we do? Part of it is, I think we need to be reaching out to our elected officials and find out, like, what are you doing about this? How are you approaching this question, not only in terms of the funding, but like shining a spotlight on what's going on at the VA system.
No, I appreciate that. There's a lot to unpack in that, Jose, and I'd love for Kevin and Julia, either one of you, to talk a little bit about, some of what Jose mentioned. In general, I think, one of the questions actually that's coming in is Anna has asked, I'm worried about the mental and emotional health of our frontline workers. They're experiencing so much trauma. How can we help them? And I'd love, your input on that. Yeah.
Well, from my personal experience, excuse me, having worked alongside, colleagues from a multidisciplinary team in healthcare, you see in the emergency room attracts a certain type of personality, I think, but also, throughout healthcare, also not only the emergency room. I'm doing some pro bono work right now with a couple of frontline healthcare workers. Right now, they all happen to be nurses, and they are experiencing trauma on a whole different level than they are used to, and frankly, that I think they are prepared for. They're all doing okay, thankfully, but it's a very different experience. I think if you train and you anticipate, I'm going to go work in a healthcare setting, maybe I'm going to work in an emergency room, and maybe I expect that I may encounter a patient who crashes or who unfortunately dies. Maybe every couple of weeks. I asked this of one of these nurses that I'm working with, how frequently, she's been a nurse for 3 years, how frequently has she encountered the loss of a patient? And really, she could count the number of times a patient of hers had died on one hand. And over the last 2 months, she's been working exclusively with COVID patients in the emergency room, and she's losing several patients per shift right? So she works 3 12-hour shifts every week, and patient after patient after patient is coming in with very similar symptom presentations. And the toll that that particular kind of trauma, that particular kind of work takes on frontline healthcare workers of any kind is really very significant, and I think something that a lot of people feel totally unprepared for.
Yeah. Kevin?
Yeah, just, not to, I think Julia's experiences are very telling about what's going on the front lines. I also have some experiences with some clients who are nurses. And, I just want to highlight the aspect of their own physical risk taking and the risk taking that they place their families in as well.
Yeah.
Not just the nurses, but also police officers and pretty much anybody that EMT units, anybody that has to be in contact with people. Like you said, Julia, maybe they signed up to deal with death, or maybe they signed up to deal with harsh conditions and trying to help people that can't be helped. But many of them did not sign up to put their own lives at risk. And
Right.
even if you were to say that, for instance, police officers or other first responders do sign up to put their lives at risk, well, they don't typically sign up to put their families at risk. I know one police officer who is trying to petition their town to supply the police budget of the town so that they can rent out hotel rooms, because they don't want to be able to do this frontlines work, be on the testing centers, doing all that kind of stuff, being the first ones in any house whenever there's a call, but then have to take it back home to their family. So I mean, the idea of their own strength through this is, I think, a real hallmark for them. And the thing that's to me, the most testing part of this is, can they not just endure the tragedy that they see, but can they endure this idea of walking the plank every time they go to work? And it becomes very, very personal very quickly. And unfortunately, there's not much that we as therapists can necessarily do to help that. That's, again, more on the municipalities. That's more on, where the money is to help them.
Yeah, I mean, there's a lot of processing that they're going to have to be doing, right? I mean, it's, I imagine it is similar to what veterans do. I mean, this is kind of the parallel in some ways that I can, at least as a layperson, see here, which is that when you're in the middle of it, you're, what I hear anyway from the frontline healthcare workers and essential workers, that when you're in the middle of it, you do what you can to get through it, and you keep going back. But there's a lot of re-traumatization that's going on. And then, when they have a minute to breathe or a couple of days to breathe, I think that processing and that, it comes down like a ton of bricks in some ways. And the long-term health effects, the long-term psychological effects are the ones that I think we don't even know. It feels as if they're going to reverberate for a very long time. So I don't know what lessons we can take, and Jose, maybe you can speak to this, of the things that we maybe have done right or maybe have not done right with veterans that, we should be thinking about as a society for all of these folks, moving forward.
Yeah, for sure. I mean, when you go to basic training, one of the first things you get assigned is a battle buddy who you're responsible for, and you get yelled at from by the drill sergeants if you don't know where your battle buddy is. So I just think that it's just an interesting time for all of us. I'm the oldest of 5 kids. I have other siblings, and all these years that we've been grown, we're all grown up now, we all have kids, we've never taken the time to do a conference call with all the siblings and the kids together, and we totally did that during this time. So I think that we're all social creatures, and really need that connection with other folks. And the other thing is, I know lots of vets that live on their own, right? And so just kind of texting people on a regular basis. Hey, how you doing? Do you need anything? You know, if I go out shopping, I text other folks that I know, you know, or have limited mobility, and just like, can I pick something up for you? So I think that, like, I don't know that that's anything special to the military or veteran community. I mean, certainly vets are pretty resilient people. You know, I also have seen a lot of our members are just volunteering. You know, like once they know that their families are safe and secure, you know, folks are volunteering with different organizations to deliver food to elderly folks who, you know, are on their own. And I think that, you know, it's a difficult time, and it's going to bring out the best in folks. You know,
Yeah.
I've been living in New York since 9/11. You know, that was a very similar type of situation here in New York City, just in terms of, you know, people having to pull together. Hurricane Sandy is another example where, you know, just like the whole city was kind of knocked out. You know, I'm optimistic that we'll get through this, and I think that whatever initial shock people had, and sort of the urge to hoard, and, you know, the whole toilet paper shortage, I think we're getting to a place now. It's been 2 whole months, right, that we've been at this, and so I think that more and more folks, once they sort of like feel a sense of you know, relative safety, and have sort of a routine down, I certainly encourage people to take the time, you know, go through your phone list or your Rolodex if you're still using those, and you know, call through your, you know, have your own sort of like personal outreach, and if that's, you know, if you've gone through that, then there's plenty of other opportunities to you know, volunteer with your local organizations that can definitely use your help.
No, that's a great point, Jose. And I think there's a question that we have that relates somewhat to this as well. Kevin and Julia, feel free to jump in. Somebody's asking, you know, what else can we do for mental health while social distancing besides via social media, or, you know, Zoom in this way? Jose mentioned, you know, sort of reaching out and talking to folks in your family and getting together. And this particular question is, what else can we do besides social media? Any virtual events or online mental health access that is recommended?
Well, I'll jump in. So first of all, I think that a lot of people, some people who have been in therapy and some people who have never been in therapy, a lot of people in either camp may feel confused by what is therapy like over the computer, right? How can telehealth work? How does it work as well? Many people find it confusing or somewhat alienating. I think that that's reasonable. And also my experience is that it's actually working pretty well for people who are open to it, and for people for whom, you know, it can serve as a resource or as a support. So I would definitely encourage people who are wondering about telehealth and whether or not it's right for them to give it a try. And I know that we're going to throw up some resources at the end and through your campaign page that can link people to different options for support, for telehealth support. In addition, there are different kinds of national hotlines that are available for support if people are looking to connect. One thing I wanted to acknowledge, though, that in the midst of all of this, connecting for some people is what feels best. And also for other people, disconnecting from their devices, checking out from social media, not really speaking to a whole lot of people on the phone or emailing, that's what feels best. And I think that it's important to hold space for both options, because I think lots of people, frankly, are experiencing mood changes like this, sometimes by the hour, sometimes by the day. I think that could largely be weather dependent, or, you know, media consumption dependent. It depends on a lot of different factors, but to feel a lot of variability around mood and thoughts and feelings is really common, really normal in a time like this. And so I would encourage people to pay attention to how you're feeling. Do you want to connect? Do you want to disconnect? Are you sort of experiencing a mix of the two? And to also keep in mind that what works well for one person may actually be the worst thing in the world for another person. And so what I'm hearing a lot of in my practice is that because people are, for example, families may be sheltering in place together, or if you are staying in touch with a friend or relative, but you live separately, what resonates for one person may not resonate for another person. And again, to keep in mind that that's okay, right? What's going to be okay and feel safe and work well and feel like a resource or support for one person may not actually feel that way for the next person. So I think it's important that people find what works best for them.
So how do you know, as a follow-up or related question, when, we're all, I think, feeling anxious to various degrees, right? We're obviously in the middle of a pandemic crisis. There's lots to be anxious about. There's, of course, a lot to be thankful for as well. So I'm curious how you know if, what you're feeling is normal amount of anxiety, or when folks should be reaching out for help, and, the kinds of help that might be available in the middle of the crisis. So Kevin, do you want to
Yeah,
take
I'll
that?
jump in on that one. So the first thing that, and I've been actually repeating this to many of my clients throughout these weeks, is that what we know of, or what we actually knew of colloquially as anxiety during this pandemic doesn't actually fit anymore. Because as we know anxiety, we kind of think of it as this kind of overreaction to something, or being afraid of something that isn't really something to be afraid of, or maybe a rationalization of something that could be changed with a different perspective. But what we're going through now is very real, and it is very unsafe, and it is unavoidable. And so really the most apt kind of diagnosis for this time is acute stress disorder. Not necessarily anxiety, even though it's on a branch of anxiety, but not the way we talk about it, So when you say the word normal, normal is a really high bar right now. Normal is, if you are crying every day, that's normal. So I don't want to necessarily put the message out that you have to be abnormal in order to seek help, because while we're under stress, all of us are under this acute stress. You might need help, and that's completely in the normal range of behavior. We all probably need some help. So I would encourage anybody who's even contemplating it, thinking, maybe I shouldn't be dealing with this alone, or maybe I shouldn't be dealing this with my traditional coping strategies, to reach out, because it's only going to take a visit or two to find out for sure whether you need it. But chances are you need it. Chances are you need it. So I would encourage anybody to not only test out the waters with someone, but I would even encourage them to test out the waters with multiple therapists. Finding somebody that jives with you takes a little time. And in this virtual mode, it might be actually harder to feel out a therapist, which is the most key ingredient to actually getting any kind of relief or help from what you're dealing with. So I'm telling people, like, hey, you found me, that's great. Now go find 2 other people, because you want to be able to kind of test out whether or not this relationship is going to work in this weird kind of virtual way, which could be very intimidating for people. So, I mean, acute stress is what we're trying to endure right now. And the goal is not to cure anxiety, because it's not going anywhere. It's a normal response to the situation to be anxious. To ask somebody to not be anxious in the situation is to ask them to not be human, and that's not okay. We are all going to be anxious. I'm even anxious. But what we need to be doing is enduring the process so that we come out to the other side, relatively unscarred. The thing, this is something I've been telling my clients often, is what you're trying to do, the goalpost here, is to not let this turn into what happens to acute stress after the fact. And we all know what that is, post-traumatic stress disorder.
Mhm.
So what we're trying to do, the only goalpost that I think is relevant, the only expectation I think is relevant, is to try to make sure that we don't turn this, what we're going through, into PTSD down the road.
Mhm.
And of course, plenty of people will. But I'm saying, like, if you're thinking that your anxiety is going to be leveled off and you'll be good to go during a pandemic, that's the wrong thing to be thinking. You should be anxious, you should be afraid, and you should be seeking help.
I just want to jump in and add a point, if I may, which is that, you know, in the midst of a crisis, in the midst of a traumatic event, and, you know, when I think of trauma, I think in terms of big T trauma and little t trauma. And I think, you know, a traumatic event is an incredibly subjective experience. And so it's for each individual person to decide, does something feel traumatic and to what extent it feels that way? But there's no right way or wrong way to experience a traumatic event or to survive a traumatic event. And for many people, this time right now, the last 8 weeks, maybe even longer than that for some folks, is living through a traumatic event. Some of those people may already have existing trauma histories, and for some people, this may be the first traumatic thing that they've ever experienced. Regardless, in the midst of a crisis situation, and again, I think that's an appropriate term for many people right now, the only goal, the only priority during a crisis is stabilization. So what that means is, are your basic needs met? Quite literally, can you breathe? Can you find food? Do you have water? Do you have shelter? Do you feel like you have adequate resources to meet your very most basic needs? Not necessarily are you baking everything from front to back on Pinterest, right? And are you all of a sudden knocking it out of the park without a master's in education, homeschooling your kids, right? And I think that I've certainly seen a transition from the beginning of this. So I'm thinking in terms of like 8 weeks ago or so, lots of people talking about how they're going to use this time. It's going to be magical. We're going to make wonderful memories as a family, and we're going to get to spend all this time together. And I'm going to, you know, sort through and take on early spring cleaning of my garage and every single closet in my house, to hold on a second, we really need to refocus. And what are we able to do right now? For some people, that may simply mean I'm able to get up in the morning, I'm able to brush my teeth, make sure I have some food in my belly, and make sure that all of the living things and creatures in my home and under my care are cared for as well. And if that's how we're measuring success in a given day or week or month, go ahead and consider that to be knocking it out of the park. Because again, in a time of crisis, during a traumatic event, the only priorities are those that have to do with stabilization.
So it sounds to me like there needs to be, or at least, you know, in general, we need to start accepting the fact that it's okay not to be okay. That
Definitely.
it, you know, which is that that this is hard. And this is hard for all of us, no matter, you know, where we are, you know, and no matter what it is that we're doing. So you spoke to something, Julia, you know, you talked about remote learning, and we have a question actually that says, everyone I know who is still working from home and has kids is struggling. Remote learning is straining families and children. This doesn't feel sustainable. What can be done to help families? So I'd love to hear either your own experiences or just, you know, what you think can be done to, you know, put that oxygen mask on yourself and for others.
Yeah, it's, I agree with whomever put that question out there. It's not sustainable. And, you know, I have, I'm working from home now. My husband is working from home, and we have 2 school-aged children who we are, we're trying to facilitate distance learning for them as best as we can while maintaining our full-time employment. And again, I'm not a teacher and I don't pretend to be, and I've always respected the hard work of teachers, and now that's in overdrive for sure. But like I've been talking to many of my clients about, wherever that bar used to be set, I'm encouraging everybody to lay it down on the floor. And if you're able to get even this much over the bar, if not meeting it where it's at on the floor some days, then that's okay, right? Because again, I think that there's a shift that's happening, that's already happened and continuing to happen. I think that more and more of us are coming to terms with, which is that this is not functioning. We didn't put life on hold, and we're trying to continue to function within life as we knew it, right? There's a shift that has started to happen, and I think will continue to evolve, that we are shifting to a new way of normal. And as far as homeschool is concerned, again, this changes in my home on a regular basis, by the day, sometimes by the hour, and making sure that basic needs are met, both mine and those of my children. If we're able to do beyond that, and as that includes daily assignments and homework and projects, I consider that to be gravy. And I'm trying to stay mindful of giving ourselves credit where credit is due. If we survive the day, fantastic. If we submit the assignment, fantastic. And I'm trying to celebrate small victories as they come.
Kevin?
Yeah, I'll also speak a few points. So the first thing is that what I think a lot of parents need to realize is that, yes, and while we're seeing our teachers as heroes, and they certainly should be felt as heroes as we try to take on some of their job and we feel how stressful that is, the one advantage that teachers have over parents of many is that they have a full classroom of children. Now you might think, well, that makes it harder, doesn't it? Well, not necessarily, because when at least 80% of the class is sitting and listening, it puts a lot of peer pressure on your child to sit and listen as well. And without that peer pressure around, and within the confines of their normal kind of home life, the ability of a child to be in school mode is significantly reduced. They're in home mode trying to get through some schoolwork. For them, it's more like homework, especially for the younger children. It just doesn't feel like school. So they're not in the zone, so to speak. And so that puts a desperate pressure on parents to not only teach and guide the children through the school day, but also keep them interested, motivated, focused. And those things are very hard to come by right now. So I completely agree with Julia. Like, you got to drop your expectations about what you think you're going to get done. And even if you were available to your children for the entire school day, which many parents are simply not, you still wouldn't be able to do what a teacher could do. So knowing that, I would like everybody to maybe consider what would happen. Let's take a thought experiment. If you were to take your children out of school for a year and you were going to teach them the basics, but then you were going to try to instill their lives with a whole bunch of other stuff that you would like to teach your children. If you're going to take them out for a year and homeschool them, what would you be teaching them? What experiences would you like them to know? What things are important in terms of family values that you'd like to put into your children? In many ways, this pandemic has brought us somewhat of an opportunity to take control of our child's education. Obviously we should be doing what the teachers are saying to do throughout the day, but let's not forget that when they're done, or in between when they're done, there's so much more. Your teachers don't have access to your kitchen. So you could be teaching math in the form of baking. You could be, like, for instance, I'm teaching my daughter a lot of math because we do Sudoku together. And that's just like something that wouldn't necessarily happen in school. So there's a lot of things there's a lot of opportunities here as well. I think the teachers in Glen Rock in particular are doing a fantastic job. I was able to see, if anybody wants to go and look at it, there's an excellent highlight that Dr. Charleston put together of some of what the teachers are doing in last night's Board of Ed meeting, and it's up. It should be up now at the board at the Glen Rock School's website. There's a great snippet of just what a couple of different teachers are doing, and they're doing a fantastic job. But honestly, we're parents, we work, we don't have the acumen nor the environment to facilitate learning the way our teachers would. Just do the best you can. If they learn absolutely nothing this entire rest of the year, your kids will catch up. It's okay.
Yeah, that's a great point. And I think, I also want to highlight, for some of us, and we're lucky enough to have great teachers. We're lucky enough to have a good program and technology and the ability to, be able to do that with our kids. And for far too many of us, that may not necessarily be available. And so the ability to, to say that it's okay that the kids, we're going to do our best to support them in the multiple different ways that we can. I think, again, highlights the kinds of things that support needs to happen from the institutions as well, and through the community. But, making sure that we're highlighting the fact and emphasizing the fact that this is not the same thing as a school year. And this is, as I've heard over and over again, a crisis, and we're just dealing with it the best we can. I think that's important. We have one more question, actually a couple more questions. So Amari asks, for LGBTQ youth in unsupportive homes, how can they cope with emotional, mental, physical, and financial trauma?
Well, I first of all, I really appreciate this question because, as I mentioned in the beginning of our talk tonight, the bulk of my practice deals with and provides support to folks who, we're all being encouraged to stay at home. Outside, the outside world is posing significant threat for our health, our wellness, our well-being. So stay home to stay safe, right? And from the moment that this all began, what keeps me up at night are so many of the patients that I've seen throughout my career, and where home is actually the most unsafe place of all. And I think that it can be particularly true for LGBTQ teens or people who are sheltering in place or at home with family who are not necessarily supportive, or who may be abused or victimized in different ways. And also for lots of other people who find themselves who, typically speaking, going to school, going to work, being able to move freely between lots of different spaces is the safer alternative to being home. And I think it's important to reiterate that, again, some of the resources that we're going to be highlighting up on RT's campaign resource page are national 24-hour hotlines that are available 24 days a week. 24 hours a day, 7 days a week, 365 days a year. If people need support, in the midst of a crisis or a traumatic event, certainly, but also if somebody really just needs a space to talk through something with somebody who's a trained professional or a trained volunteer at 3 o'clock in the morning. But I think it's really important to acknowledge that while so many of us, if not all of us, are being encouraged, if not, in an enforceable way, to stay at home for our own safety and for the safety of the community at large, to keep in mind that home is not necessarily a safe place for everybody to be.
Yeah, and I think we had a similar question for those who are who might be in danger of domestic violence, what one can do to support.
Yeah, so, I think certainly resources look a bit, and support looks a bit different when somebody is at home. Whether that means that we get creative in terms of how we're accessing telehealth services, or when I'm talking with clients about something called safety planning, which is very similar to fire safety planning. It's, the time to plan for what to do, how to safely survive and escape a fire is not when you smell smoke, right? It's to plan that ahead of time and to think it through a couple of times over. I do something similarly with survivors of domestic violence who may be in a relationship or living with a partner who is abusive to them. There are a lot of ways to be creative. I think the overarching most important message here is that if you're a survivor, if you're afraid at home, if you feel unsafe at home in any way, shape, or form, you are not alone. And that there are resources out there that are available, again, 24 hours a day, 7 days a week, in the form of telehealth support via a therapist, and national support hotlines.
Great, thank you for that. I think our next question is, some of our region's most vulnerable mental health consumers are in group homes or depend on the services of self-help centers. They lack the resources to connect virtually. What are some policies and practices that can keep this population connected to the services they desperately need? So I'm not sure, maybe Jose, you'd have some insight as to how we can help either folks in, from the veterans point of view, long-term healthcare facilities, or, others, I don't know, from Kevin and Julia, folks in, group homes or other types of centers that may not necessarily be able to connect in the same way as those of us in Glen Rock do, and whether clearly that highlights a need right there, an unmet need for us to be thinking more holistically about folks in many different ways, and I'm just curious whether you know of services or places or things we can do to help.
Yeah, I mean, the only thing that I'm aware of is that, the really great like nursing staff and some physicians are basically just helping families do FaceTime with their loved ones, right? Particularly in places like nursing homes. I'll be honest, I'm not too familiar with the, situation in group homes per se, but I know that, what this situation is sort of highlighting and probably a lot of different institutions are wrestling with right now is like, how do you accomplish, the mission of your institution or organization when you can't be face to face, And I think that while most of us probably have taken access to things like, Zoom conference calls and such, it's just sort of like a certainly in my line of work, it's a regular thing. It's an everyday thing. But then there's obviously this like digital divide, for poor and low income communities. Certainly folks that are in different institutional settings. It might be there's HIPAA regulations to be mindful of. But also it's just a question of resources, right? That like, New York City public schools quickly realize like, oh, we can't do this distance learning if kids don't have access to the internet or even an iPad in the house,
Yeah.
Which is, a reality. And so they had to sort of quickly figure out a way to distribute those pieces of equipment and get people connected so that they could continue to get, vital education. So those are my initial thoughts. Yeah.
Yeah, and for sure. I mean, we have that in NJ5, right, in Hackensack, which is a city not so far away from where we are, where not everyone has access to Wi-Fi. Not everyone has access to all the same kinds of technology, as you mentioned, iPads, laptops, all of those kinds of things. And so remote learning becomes a much harder thing to do. Especially when kids are sharing one device, one phone, they're told to go outside the parking lot of a library to get Wi-Fi from there. It really does highlight the the inequality that we have. And really at the end of the day, also that there are some things that are becoming or have become standard. And doing things like net neutrality and broadband access is absolutely a given for our society moving forward. And for some of us not even understanding that divide exists is something that has been revealed through this pandemic crisis. So thank you for that. So we have some questions about grief and grieving, and it's sort of how can we grieve when we can't be together? I know, unfortunately, with COVID-19, we've had a lot more people die than anticipated, at least when some people were thinking this was just like the flu. And so, the process of grief when your loved one passes away, especially with the isolation, is a really fraught one. It's really heartbreaking. Jose brought up the FaceTime and that doctors and nurses are doing, but when someone dies and not being able to grieve with your family or say bye to the person is really heartbreaking. And also, how can we help others grieve when you hear about this? And I know for sure, I personally know multiple people who've had losses, and it's difficult to know how to help comfort and how to get through this. And I'd love to hear your thoughts of how you've gone through this, or what you would recommend.
So I'll jump in if I can. So this is obviously, a fairly unique experience of grief for many people. Certainly the idea of being able to grieve somebody without being able to say goodbye or be with their family has been, done throughout the ages as well. But this is unique in that this is kind of a mass experience and an expected experience of grief, where you're not going to be able to be with the person who is passing, nor will you be able to be with loved ones and cry on their shoulders and do what typically we need to do. Unfortunately, one of my clients who works in a cemetery has been telling me all sorts of terrible ordeals of how people have to even conduct funerals now. Basically having to stay in their cars, not being able to be with the body, oftentimes being with a body that's being lowered next to one that's just been lowered right next to them, and the one before that, and the one before that in succession. This is definitely a unique time for grief, for sure. So the first thing I'll jump in and say is to talk about kind of accepting where we are, that what you might have wanted to do with grief is simply not going to happen. And that actually is another layer of grief. Grief is about loss. And it's not necessarily just about loss of a person. It's about loss of a future. It's about loss of an idea that you may have had. Grieving comes in many forms about whatever your expectations were that are no longer going to be valid. And the way to grieve is one more thing to put on that list. So I would encourage everybody to first off, remember that this grief is not something that happens now. Grief reverberates through your life. And, it's going to be with you a year from now. It's going to be with you 5 years from now. It may not feel as debilitating then as it is now. But grief is a process that lasts your lifetime. Whenever you remember, whenever you miss somebody. I would encourage everybody to find some way to symbolize a goodbye. It's a very personal thing, but symbolism when it comes to grief is extremely important. That's why we even have funerals. The idea of a funeral is to do something, a tradition, that you know what to do next, and then you know what to do after that, and then you know what to do after that. And because we're doing that symbol of process, it helps people to get to the other side eventually. Not to say that people are done grieving after a funeral, but certainly that we remember everybody that's passed at every holiday. that they were able to say goodbye in some fashion. I had one client who recently had her father pass away from this, and her father and her are fairly estranged. But needless to say, she still needed to grieve, and they also live very far apart. So I recommended to her that even though that they haven't spoken in a long time, or they haven't had any kind of real connection in quite some time, that she still try to get some kind of object eventually from his life to be given to her. Whatever it could be. It could be something trivial, it could be something meaningful, but just to have some object, a transitional object from her father. And when she receives that object, then she can basically import her goodbyes into that object. Symbolism is hugely important in the process of grief, is what I'm trying to say. And if you can't have the real thing, as we often, and now we can't have the real thing, then to find some way to symbolize a goodbye, to write letters, to talk into the air. These are things that can help kind of dislodge some of that urgency about the grief that people might be feeling right now.
Well, I really appreciate that. I know that we are actually just a little bit over time, but clearly we could have been talking about this for a very long time. So thank you all really for being here and sharing your thoughts. And, you know, as we leave, first of all, we have more questions that are be sharing them with you, and love to hear your answers so we can, you know, share them back out with folks who've asked. But as we leave, I'd love it if each one of you just shared one of your favorite coping mechanisms right now that is working for you, or that, you know, you would recommend somebody try. You know, for me, it's taking walks with or without my dog, and it's taking walks where there are lots of trees. But I'd love to hear that as we leave. And thank you really very much for being part of this. You want to go first, Jose?
Yeah, just, you know, thanks for the invitation, and, you know, appreciate your leadership. You know, very much looking forward to how the campaign goes. You know, and I'll just point out for those that are still watching that I doubt Scott Heimer is holding a webinar with his constituents right now. So that's just an important difference, that, you know, you care enough about your community to put something like this together. I think that's really important for folks that are going to represent us in Congress. In terms of my coping mechanism, we're fortunate enough to live near Central Park, and so, you know, similar to you, just kind of weather permitting, a daily walk in the park, even if it's only for, you know, 20 minutes, 30 minutes, just to get some fresh air, you know, and try and combat the cabin fever of being stuck in a small 2-bedroom apartment. So I'll pass it to Julia.
I'm going to list two. One of them is going to be super quick. There are a lot of apps out there that offer, several of them are offering some pretty great promotions right now. I have no ties to any of these, but apps like Headspace, Calm, 10% Happier offer some really fantastic guided meditations, relaxation techniques, mindfulness practices. The second thing that I would offer is paying attention to your breath and your breathing, because sometimes when we're feeling a high degree of anxiety, stress, other kinds of somatic issues, sometimes holding up and getting stuck in our breath is one of the places that we may get stuck in off the bat. And so if you can pay attention to and allow yourself a deep inhale and an exhale to go with it, really has a significant impact on calming down our nervous systems when they can be feeling incredibly out of sorts for lots of different reasons at a time like this.
Great, thank you.
I think that I'm not going to say my personal coping strategies, because I don't think, you know, any ideal idiosyncratic person's coping strategy is going to work for anybody else. But I will say what I would recommend to people. And the first is, you know, thinking about stress. I often use the imagery of a boat that's got holes in it and the boat's leaking in. And there's many things that you can do to remedy the situation. One is to bail out water That is essentially what Julia was just talking about and what Jose was just talking about in terms of being able to de-stress, meditate, breathe, do what you need to do, find your mindfulness. Those are ways to kind of get the stress out of your system. The other thing is to patch up the holes. And patching up the holes in this case is about limiting your information intake. You don't need to know every single little detail that flashes across your screen about this pandemic. You need to know the essentials. You need to know the local essentials. You don't need to know what the current death toll in California is right now. Limit your intake, because every little bite that you absorb stays until you bail it out. So that's the second piece. And the third way to have a better experience with your leaking boat is to simply have a bigger boat, a more robust boat. And that's where I turn to joy. The ledger right now is extremely unbalanced into the negative side. We need to balance it with joy. So I'm talking about laughing. I'm talking about smiling, singing, finding ways to experience joy is hugely important now. And yes, it's okay. It's okay even if your uncle has just died. It's okay to do this even if you're a frontline worker. It's okay. You absolutely need it. It's good hygiene to laugh huge and find things to supremely enjoy. This is how we endure a pandemic that is going to be hitting us with waves of grief, for many months to come now. We have to balance it out with joy. And that's to me, that's the most important thing, So those three things, I would say are the best ways to cope.
Well, thank you so much. I think that's great. I will say that I've taken away a lot from this conversation personally. I think in terms of policy, it's just solidified, for me, my personal point of view that mental health care has just long been ignored in our healthcare system. Clearly, with a system like the VA, where we've seen parts of it work, except it's not working quite as well as we want it to in certain cases right now. But really, for me, just thinking about the reverberations, as we've talked about, of this crisis and what it's going to be like for time to come, really reinforces my belief for me to fight for policies like single-payer healthcare, to fight for having mental health care be an important part of our healthcare system moving forward, because it's clear that we all need it. And that I think that especially certain populations are going to need it a lot more than ever as we come out of this crisis, as we deal with this. And Kevin, as you pointed out, this grief and aftershocks of this crisis is going to be here with us for years to come. And I think that clearly tells us that we need to build a much more resilient society, and robust, and mental health care is a big part of that, which is what I truly believe we need to fight for. So thank you all for being here. Thank you so much for all of your insight and your input. I really appreciate you giving us your time. We'll be trying out all of the coping mechanisms that you mentioned, including choosing joy and choosing, how to be a little bit, how to seek that out in our daily life. We have resources for those of us looking to help, to give and receive help. So please go to ourtheforcongress.com/COVID-19. You'll find them there. And thank you all for tuning in. Really appreciate it. So thank you.
Great. Thanks for having us.
Thank you.
Thanks a lot, Arti.
Take care, everyone. Stay well.
Thank you.